Watch for a runny nose, sore throat, and other cold-like symptoms. Most types of coronavirus cause mild to moderate cold-like symptoms, which generally don't last much longer than a week. Make note of headaches and body aches. Some coronaviruses, such as the virus that causes SARS, severe acute respiratory syndrome, can cause flu-like aches and pains. Be on the lookout for headaches and pains in your joints and muscles, especially in combination with a fever or other flu or cold-like symptoms. Check for a fever. Severe forms of the coronavirus, such as SARS, MERS, East Respiratory Syndrome, and the new China strain 2019, nCoV, often start with a high fever. Check for a fever of 104 degrees Fahrenheit 38, 0 degrees Celsius or higher. Look out for a cough and shortness of breath. Some forms of coronavirus, such as SARS, MERS, and the novel coronavirus recently identified in China, are characterized by severe respiratory symptoms. These symptoms typically include coughing and shortness of breath, along with a fever. Pay attention to diarrhea or vomiting. Sometimes coronaviruses can cause gastrointestinal symptoms as well as respiratory problems. You may have a coronavirus if you have symptoms such as nausea, vomiting, or diarrhea, especially if you also have a fever and respiratory symptoms. Call your doctor right away if you think you have a coronavirus infection. A coronavirus infection can potentially become deadly, especially with a serious strain such as MERS, SARS, or 2019 CoV. Allow your doctor to test you for a coronavirus infection. If you have severe symptoms or if they suspect you may have contracted MERS, SARS, or a novel coronavirus, your doctor may recommend a laboratory test to confirm your diagnosis. These tests typically involve taking a sample of your blood, sputum, saliva and phlegm that you cough up, or material from a swab inserted into your nose or throat. Follow your doctor's home care instructions carefully. There's no specific treatment for coronavirus infections yet. If your doctor diagnoses you with a coronavirus, they will likely send you home unless you have severe symptoms that require hospitalization. Stay home and rest as much as possible. Getting plenty of rest is vital for helping your body fight the infection and recover. Additionally, staying home will help prevent you from spreading the infection to others. While you're infected, stay home from work or school and avoid strenuous activities around the house. Take over-the-counter medications to manage pain and fevers. If you have symptoms such as body aches, headaches, or a fever, you can get relief with medications such as acetaminophen, Tylenol, ibuprofen, Motrin, Advil, or naproxen, Aleve. Use a humidifier to ease a cough or sore throat. A humidifier can help soothe your throat, lungs, and nasal passages. Set one up by your bed at night and wherever you spend most of your time resting during the day. Drink plenty of fluids. It's easy to get dehydrated when you're sick. While you're recovering from a coronavirus, keep sipping on water, juice, or other clear fluids to fight dehydration and loosen up congestion. Get emergency care if you develop severe symptoms. Some types of coronavirus, such as SARS, MERS, and 2019 CoV, can develop into life-threatening infections. 23. Go to the emergency room or call emergency services if you develop severe symptoms, such as difficulty breathing or chest pain when you breathe. Limit contact with infected people as much as possible. Many strains of coronavirus can be spread from person to person. If you know or suspect that someone is sick with a coronavirus, avoid close contact with them as much as you can. Stay away from farm animals and wild animals. Many coronaviruses are spread from animals to humans. The most common animal carriers of coronaviruses are civet cats in China and dromedary camels in the Middle East. Cook meat and other animal products thoroughly. You can get coronavirus infections and other diseases from consuming contaminated or poorly prepared meat or milk. Wash your hands regularly with warm water and soap. Hand washing is one of the best ways to prevent the spread of coronavirus and other diseases. Avoid touching your eyes, nose, and mouth. Respiratory viruses like those in the coronavirus family get into your body through the mucous membranes in your eyes, nose, and mouth. Clean and disinfect all objects and surfaces a sick person has touched. If you or someone in your home is sick with a coronavirus, prevent the disease from spreading by cleaning anything they come into contact with.